Although we're still relatively early in the coronavirus pandemic, what do you think its impact is going to be on physician burnout, particularly among primary care doctors? Is it likely to cause more doctors to feel exhausted and overwhelmed? Or could it maybe give them a new sense of meaning about the importance of their work and reduce feelings of burnout?
So I think a lot of it remains to be seen. The likelihood is that it will increase burnout. We're in the, like you said, the early phases of the coronavirus. There's really predicted to be four different phases. The one that we're currently in, which is really the immediate morbidity and mortality related to COVID-19. The second phase is anticipated to be the impact on urgent non-COVID conditions. So all the resources are currently being directed to fight the virus, which is what it should be. But there's a lot of other chronic and acute health issues that are coming up. So that's supposed to be the second wave. And those are both sort of, I liken this to being asked to run a sprint and a marathon at the
Yeah.
same time. The third wave is really anticipated to be the impact of interrupted care on patients with chronic conditions, and that's where it really will start to hit the primary care physicians more. And then the fourth wave, which is supposed to really be an exponential wave as well, is the sort of the psychic trauma, the mental health issues, the burnout that you mentioned, that is likely to escalate and then stay elevated for some time. And that's because of the common drivers of burnout. One of the biggest drivers of burnout is control, and physicians feeling like they don't have control, and talk about the perfect storm for that. We have it acutely with physicians taking care of patients with a very contagious, a very deadly virus, often without appropriate personal protective equipment. Being asked to work longer hours than typical, where they have sort of less wherewithal, less ability to really provide the care that they want. On the primary care side of things that you talked about, lack of control, really physicians do a lot of things based on guidelines and experience and routine, and now that's all thrown out the window. We're not able to see our patients in our clinic unless it's something really emergent because of social distancing, and we're needing to learn how to provide telemedicine care, and all of the rules and regulations that go along with that. So really a ton of loss of control. A second big burnout driver is really alignment with organizational culture and values. And acutely, again, the need is with patients with the acute virus, and that's quite appropriate. But primary care physicians long have felt like they may be under-respected by the powers that be. And again, things are being pushed down the road. And so that sense of not feeling valued, I think, is escalating for people in the primary care setting. A third really important driver of burnout is the loss of social support and community. And because people are socially isolating to prevent the spread of the coronavirus, they're really losing that work support network that is really important in maintaining well-being. So there's a lot of the drivers that are likely to make it worse.